Welcome to 5 Stone. Prepare, respond, serve. At 5 Stone, we bring you years of experience from law enforcement, former military, combat instructors, licensed medical providers, first responders, to motivate you, to help you become more prepared. So get ready for product reviews, interviews with the professionals, hot topic discussions, to help you be ready for what this world can throw at you. So welcome to 5 Stone. Let's go. Hey guys, this is Eric and John on with the next video in the series of a kind of range safety or outdoor safety, I guess you could actually say. We've dug through our packs and gone through some of the gear that we typically carry on us, and have the last video was over the cat tourniquet, or the different tourniquets, to show you how to apply those in case somebody was having hemorrhagic bleeding. And so now we're going to move on to gauze. Gauze is something super important. I think everybody needs to have in their pack, and not everybody really understands how to use the gauze. And we're not going to go to some big crazy medical demonstration and all that. This is just general information of how you could use gauze, maybe to apply more pressure to help stop bleeding, and how actually he's going to show how to use it without using tape, which is very important. Yeah, tape is good, but in a situation where you might be bloody, sweaty, wet conditions, raining, you're trying to undo tape and tear it, like silk tape, for example. It's a good sturdy tape, man, it's hard to tear, Yeah. So
if there's any moisture, they just don't stick.
Yeah. And so he's going to show you a way to do this to give you a little bit different options. So go ahead, man.
So we're going to start out with some regular gauze or Curlex. Okay, you can buy this at Walmart, I think. Of course, I work EMS for a living, so I just get it from work. I usually try to keep a couple of these with me. It's got a paper filling on it, or package. Sometimes they're kind of hard to get open, but if you just tear it like that, come right open. Comes rolled up. This is a 4-inch, and I try to keep a couple of these, okay? And mainly for that, like if he's got a large laceration on his arm or wherever, I can just throw that on there and then use a second one to wrap it, because if it's a gaping wound, you kind of want to pack that wound. Yeah. Okay. These, if you're still bleeding for a little bit,
on an extremity.
Yeah, on an extremity.
Not like an abdominal.
Yeah. Yeah. Exactly. Yeah. But say he's got a wound on this arm here. We've already thrown one of these on there. Okay. This is locked up tight. So basically, you're gonna want to start crisscrossing it, covering the whole thing. I kind of like doing an X pattern on it. And to keep from using tape, you pretty much need to use the whole roll. When you could cut it, if you got a pair of scissors on you, being on an ambulance or on our pack, sometimes we got pocket knives that you can cut it and then tuck it. You can tuck it. It doesn't last very long or very well, okay? But it is an option. This is something I learned on the street. You just take the tip of it, tear it like that.
That is awesome.
And tie it like a shoe. It's super tight, almost like a tourniquet, but you still got blood flow. And it's easy to access.
All right, that's awesome. Let's go over just the tying aspect again, so they can watch that again. Maybe a little bit slower. So he just takes the end of it here. You gonna do a new piece?
Yeah, I'll just cut it.
Okay.
I'll leave my pocket.
A little bit slower so they can kind of see. I know you kind of rip it fast, but.
All right. So like I said, you come to the end of your roll, and a better option than tucking this, if you tuck it, sometimes it'll want to come out. If the patient moves a lot, if you're having to extract them out of the woods, it can get hung up on stuff and pull it loose, and you don't want that to happen. So basically take the very end of your Curlex and pretty much rip it in half, just like that right there. Okay? Rip it in half. Put it back on that arm.
So one goes one way, one goes the other way.
Just like you're tying a shoe. Tie it tight and then double knot it. Make sure it stays.
Yeah. It's
tight to put some pressure on that wound, but not tight enough where you're cutting off blood flow. Yeah. This is not, you don't want the same as a tourniquet application. You still want some blood flow there, but to address a major wound.
Yeah. So that's awesome. So hopefully that's useful for you guys. Like, I've seen it done, bring it into the ER. We know where I work in the ER, but I've never actually understood the whole process behind it. So I got to learn with it. That's pretty awesome. So go back and watch it over and over again if you need to, so you understand the concept. We're going to leave this on for the next video and show you how to use what's called a SAM splint. Okay, super awesome tool. I think everybody should have in their kit, their home, everywhere. These are just, you need them. So stay tuned for the next video. The SAM splint's coming up, right?
Yep.